In the last class, we look at composition and functions of development committee in primary healthcare. Composition and function of development committee in primary healthcare. We talk about community representatives, the local government leaders, local leaders, elders, women leaders. We talk about health professionals, primary healthcare workers such as doctors, nurses, midwife, community health workers, public health specialists, we talk about local government representatives such as supervisory councillors for health, councillors from local government, education unit. We talk about NGO representatives, community-based organization. Now we are going to look at religious and cultural leaders. These include the imam, the pastors, the traditional leaders. These people play a very vital role in the community. They are very influential in terms of development. They are well respected in the community. Then we have youth and women representatives, ensuring that vulnerable groups such as youth are adequately represented in decision-making processes. Functions of the development committee in primary healthcare. The functions of the development committee in primary healthcare: need assessment and planning. Need assessment and planning. They identify the health need and priorities of the community through surveys, consultation, and data collections. They develop health plans and set priorities based on the need assessment, ensuring that an intervention are relevant and effective for the local context. Resource mobilization. They mobilize resources from the community, government, NGO, or donors for health programs and projects. They ensure proper allocation of those resources to the people of the community. The next one is health promotion and education. They promote health through health awareness, such as personal sanitation, nutrition, maternal and child immunization. They facilitate health education programs to improve knowledge and behaviors related to health living. Coordination and collaboration. They foster collaboration between various community stakeholders, including government, health services, NGO, and other relevant sectors. They coordinate health activities. The next one is monitoring and evaluation. They monitor the progress of health initiatives and evaluate the effectiveness. The next one is advocacy. They advocate for better health, good standard of living, resource allocation, and so on. Community mobilization and participation. They engage the communities in decision making. They engage them in providing solutions to their health needs through mobilization of resources, human resources, uh, agricultural resources, health resources, and so on. And this now help them to participate in whatsoever engagement that is very relevant in the community. Emergency response and health crisis management. Develop and implement strategies for responding to public health emergencies such as disease, outbreak, or disaster. They organize local health teams and mobilize resources during emergency. The last one here is service delivery oversight. They oversee the function of the local health centers, ensuring the services are accessible, equitable. Ensure that the essential health services are available, including maternal and child health. Village Development Committee. Village Development Committee. Who are the Village Development Committee? This is a local governance body that plays a key role in promoting development and improving conditions in rural villages. It serves as a bridge between the government and the community, helping to implement policies, programs, and projects that benefit the local population. The compositions of the Village Development Committee. Who are the people that comprises the Village Development Committee? When you are forming Village Development Committee in rural area, you should take note of the following composition. 1. Chairperson. The elected leader who oversees the Village Development Committee is a chairperson. Election must be conducted by members of the village. The vice chairperson, he supports the chairperson. Then we have members, other members. This includes elected representatives, e.g. farmers, women, youth, marginalized groups like widows, orphans, handicaps, local leaders like head of traditional institution, religious leaders, or anybody who play a role in decision making. Secretary. There must be secretary to that committee. A person who is responsible for record keeping and managing correspondence. He takes minutes of all meetings. Treasurer. The individual is responsible for managing finances and proper use of funds. Specialist or expert. Individual with expertise in specific areas like health, education, agriculture, or sanitation. Community representation. Different sectors or interest groups within the village, such as interest group, women, men. Functions of Community Development Committee. What are the functions of Community Development Committee? We have community development planning, 1. Secondly, resource mobilization. 3. Implementation of government programs. 4. Social and economic development. 6. Health and education initiatives. 6. 5. Health and education initiative. 6. Conflict resolution and social cohesion. 7. Monitoring and evaluation. 8. Advocacy and representation. 9. Emergency response and disaster management. Emergency response and disaster management. 10. Environmental management. Then we have District Development Committee. District Development Committee. Who are the District Development Committee? District Commissioner or Administrator. District Commissioner or Administrator is a chairperson, the head of district administration. He is a chairperson and is a head of district administration. 2. Head of government department. Head of government departments. Local government departments like health department, education department, agriculture department, water and sanitation department, social welfare department, infrastructure or works department, finance department, environmental department. 3. Local government representatives. Elected leaders from local government, e.g. district councillors, municipal representative, community representative, representative from NGOs and civil society groups. We have subject matter expert, specialists on technical expert in fields relevant to the district development needs, such as urban planning, public health, disaster management or education, youth and women representative. The functions of District Development Committee. 1. Planning and coordination. Planning and coordination. Resource mobilization and allocation. 3. Monitoring and evaluation. 4. Policy implementation and advocacy. 6. 5. Service delivery oversight. Service delivery oversight. Crisis management and emergency response. Community engagement and participation. Community engagement and participation. Sustainable and environmental management. Sustainable and environmental management. Dispute resolution and conflict management. Dispute resolution and conflict management. Advocacy for regional and national resources. Advocacy for regional and national resources. Local government areas, Primary Healthcare Development Committee, and State Development, Primary Healthcare Development Committee, Federal Government Development, Primary Healthcare Development Committee are similar to Village Development Committee and District Development Committee. Thank you for listening. You can subscribe to my page, like, make comment, and ask any question related to the topic that is being discussed. Thank you.